My name is Joe Braun, and I'm an assistant professor in the Department of Epidemiology in the Brown University School of Public Health. I received my master's and doctoral degrees from the University of North Carolina at Chapel Hill. Before that, I was a school nurse in Milwaukee, Wisconsin. My research focuses on the health effects and determinants of environmental chemical exposures. I'm interested in this work because there are over 80,000 chemicals used in commerce and industry in the United States, and thousands of these are produced in excess of 1 million pounds or more per year. This is concerning because biomonitoring studies indicate that pregnant women, infants, and children who may be a potentially sensitive subgroup are chronically exposed to numerous potentially toxic chemicals. My work is being done in the HOME study, which is a prospective cohort study from Cincinnati, Ohio. My colleagues and I enrolled approximately 400 pregnant women and have been following them and their children until their 12th birthday. We've conducted detailed assessments of chemical exposures in the pregnant women, as well as their infants and when the children grew up into adolescence. We've linked this detailed exposure data to longitudinal measures of children's growth, adiposity, neurodevelopment, and asthma or allergy symptoms. Currently, I'm interested in studying the health effects of phthalates, triclosan, bisphenol A, perfluoroalkyl substances, and flame retardants. We're trying to determine whether or not exposure to these chemicals is associated with increased risk of obesity or excess adiposity, as well as increased risk of neurodevelopmental disorders like attention deficit hyperactivity disorder. We're also trying to determine whether or not there are modifiable sources of chemical exposures. People can use this information to determine how they can reduce their exposure to specific environmental chemicals. In addition, I've been working with several other prospective cohort studies in the US, Mexico, and Canada to study other early life factors that may be associated with child health, like diet. By identifying and modifying chemical risk factors for childhood diseases, we can improve the health and well-being of children in the United States and abroad because these exposures are ubiquitous and many of these childhood health outcomes are prevalent.